Hi David, thank
Hello,
you so
Yvonne.
much for taking part in the Haematology video diaries. We're very grateful.
No problem.
So David, I suppose where might be a good place to start? Perhaps you might let me know, I suppose, what your life was like before you came into the matter in 2009.
Sure, okay. Well, from a professional point of view, I work with the bank. My job primarily was a project manager, so I dealt with numerous people in different areas and different departments and certain achievements and excellence for the different respective areas. My life was generally great. I mean, my hours were long in work, obviously, in early, home late. Was lucky enough to have a job where by the weekends I did have off, well, most of them anyway. Enjoyed sports as well, enjoyed golf, enjoyed playing it, and I enjoyed watching rugby as well. I was a big, keen rugby fanatic with the Irish team and Leinster, obviously. And obviously having a partner as well as social life was great as well and all that sort of thing. So,
So
generally
busy.
holistic, busy all around, yeah, absolutely. And from a large family as well, so we all get together, nieces and nephews and whatnot. So
And when you say large, how many siblings do you have?
there's 3 other brothers
Okay.
and 1 sister, Margaret, she's the eldest, so all the nieces and nephews and whatnot after that, so it keeps us busy around.
And what led you to come to the Mater Hospital?
I suppose what led me to come to the Mater Hospital was, I suppose the story or the journey starts back in July of 2008. I got a blood sample taken. I normally get my bloods taken on an annual basis because you always hear of, different diseases and whatnot out there, and cholesterol and how your body is and all that. So I decided to get a blood test, my annual blood test taken in July.
So you would go to the GP just on a regular basis, just for regular checkups?
Yeah,
Very
regular checkups, yeah, absolutely. So I got my checkup done and everything was fine at that stage. Following that then, my partner actually noticed then as it came to December time of 2008 that I was getting tired. Noticed I was tired, I was looking a bit weak, wasn't eating as much as normal. And I was primarily putting that down to the point of view of work, because our financial years obviously is year end, so it's a busy period for us. So a lot of it I put down to actually work and stress in timelines within the work environment. Following on from that, when it came to New Year, then obviously it was kicking into a new start, both from a work point of view and getting everything ready. So again, it was a lot of hands-on, getting things ready for the next quarter. And then what happened, I started to get sick then around the beginning of March. I noticed that I was starting to get a lot tireder in the evenings. I was getting a few sweats, headaches.
Night sweats or during
There
the
were
day?
night sweats, yeah. During the day I didn't notice anything. It was at night time I was actually getting these sweats. It got to the stage then that I went to my local GP. He had a medical examination of me, about my throat, my heart, lungs, etc., pulse, and he put me on a course of antibiotics then. The course of antibiotics was to last for 5 days. I went on the course for 5 days. They did make an improvement in the beginning, all right. However, it came to the stage that they weren't, completely getting rid of the illness that I was actually experiencing, particularly with the sore throat. At that stage, being a rugby fanatic, I was over in Edinburgh watching the Ireland play Scotland. And again, over there, I found myself, I was drinking an awful lot more water, etc. Just dehydration was starting to kick in. I was able to hold my food down. I obviously had my usual 3 meals per day. I then came back from Edinburgh, and that was on a Monday. We flew in Monday morning, and then I went back to see the doctor on the Tuesday of that week, still feeling bad. He then re-examined me. He had a look to see how things were, and he put me on a stronger course of antibiotics at this stage. So I went on a stronger dose of antibiotics. Then obviously I was in work for that week when I came back from Edinburgh. I thought I was getting over, but I wasn't. And then on the Friday, which was the big build-up to the Ireland-Wales game for the Grand Slam and the Championship at the time, once I came home from work on the Friday, I went straight to bed. Again, I started to feel sick and vomiting then Saturday morning. So I remember just staying in bed at that stage, watching Ireland on the rugby pitch there in Cardiff, and me lying in bed, sick as a dog basically. It got worse. I got cold and hot sweats during the day, feeling a bit feverish, etc. Knew that this wasn't right in how I was feeling. Was taking an awful lot of liquids, drinking an awful lot of liquids, water. And then it came only to, I rang the doctor then on the Sunday around the surgery, but unfortunately he was over at the game. As usual, I wouldn't blame him, but he was over at the game, so I couldn't actually get to see him till the Tuesday morning. Come on the Sunday, it was Mother's Day that day. I wasn't able to get flowers for my mother, so my brother got them for me and dropped them down to the house. But I decided just to go down anyway and present the card and just to see her, because you only have one mother. So I called down, and again she was saying to me I didn't look great, I looked pale, and I said, yeah, I'm going to the doctor, I'm making an appointment to see him again. Went home then. On the Monday, I knew within myself, it's very rare that I'm sick actually from work and all that thing. I think I only missed a week in about 15 years of working in the bank. So I knew I was sick, really sick at that stage. On the Monday, I rang the surgery to make the appointment to see the GP. And I had a bag and all packed, ready to go, because I knew I was going to go to hospital. I just knew the way I was feeling, absolutely. That there was something, this wasn't right. Certainly whether I was going to be kept in for 24 hours or 48 hours, that's as much as I thought it would be in that sense.
And retrospectively, would you do anything different around that weekend again if
Oh, absolutely. I would have definitely tried other GPs from the point of view of being seen to.
Okay.
Absolutely. I mean, it was something, looking back at it now, yeah, in hindsight it's great, but I was always the one on my own mind, mentally saying, well, listen, sure, I'll wait till the GP, it can't be that bad. But looking back now, how stupid I was to let it go so far, in that sense. I went into work that night, the Monday night, and I went into my out of office, and I put an out of office saying I'm going to be out of work for the next 4 to 5 days. I just put that out of office because working on projects and all that anyway, you need to keep people informed, and I was on the telephone to them. As technology, you can never get away, you're always accessible. So I put that out of office in work that evening. I went to see the GP the following morning. He didn't say I looked lovely when I did see him. So he actually referred me then to get a blood test done. GP there doesn't do it. I have to go and go to the hospital. Originally, I was going to go to the A&E in Tala, but he said from the point of view of the way you're looking and how busy that is, if you want to speed it up. And obviously, I was lucky in the position that I had the VHI anyway. So he organised it for me to go to the Beacon Clinic. And it was from there I just drove home, left my car, got into the taxi, organised a taxi.
How bad were you feeling then?
At that stage I was feeling fairly tired, yeah. And again, the sweats, etc. that were on me. Got the taxi over to the Beacon Clinic, went into the A&E at 1 o'clock, got my bloods taken at 1:30, and I was informed then at 3 o'clock. The consultant came in along with 2 doctors and a nurse at that stage in the room, and that's when I was informed.
What were you informed of?
I was informed at that stage that I had leukemia.
Wow. Within an hour and a half?
Within an hour and a half, I was informed of leukemia cancer.
What was that like for you?
Wow, it was, at the time it was like, am I hearing this right? I suppose.
Were you on your own?
I was on my own, yeah, I was on my own. My partner was in Donegal at the time, so I was working in Dublin. Here. Yeah, I was on my own at the time. It was a shock hearing it, but the first thing that kicked into my mind mentally is, okay, well, how do we deal with this? So that was the first thing. The consultant was very good from the point of view of, you know, there's loads of forms of chemotherapy, there's, you know, different varieties of cancer out there. And these are the initial tests that were done. And further investigation work had to be done, and obviously I needed treatment. So it was a case of my own mind sitting back for the 2 hours while waiting for a bed to be organised for me with respect to the hospitals within Dublin. Those 2 hours I was going through it like that whole life cycle of things, sitting down thinking, well, you know, it wasn't so much of why me, or asking myself why me, because, you know, there's so much of the cancer out there. You hear the word every day of the week. It affects both kids, no matter what age you are, middle age, late age, that it's out there. So it wasn't a case of why me, what did I do wrong, why is it that it's coming on me. I didn't really go through that stage of why me. It was more the factor of going through that whole fear factor sort of thing. The fear of going through, well, the treatment and all this, and what type do I have. Just trying to get to the specifics of it. You know, is it treatable? Is there something that can be done? Or
did you think it was, I suppose, did it invite you to think about your mortality at that time?
Oh God, it did, absolutely. It was a case of knowing everyone's afraid of dying. It was a case of a real alarm bells wake-up call here.
Okay.
But I went through the stage, having spoken to the doctors, and those 2 hours on my own, I quickly went through the stages of, okay, accepting it in a way, just saying, right, okay, I have it, this is what I've been told, you know, it's very black and white.
And how would you normally have been, say, in a crisis, if I put it in that, in work? Would that be how you might have coped?
Exactly. It was a big benefit in the sense of going through change in work. I've always gone through change. I was 22 years in the bank. Over those years, we've gone through conversion from, you know, being a building society into a PLC. That was huge changes for the staff. Then there was a lot of mergers that went on, so fear factor with regards to new staff coming in who's been let go. So absolutely that did help in the sense of those 2 hours of sitting down saying, right, and the experience of being within project management, as in, okay, making a roadmap out, as in, this is what I've been told, listen, this is what has to be done, in a sense of, we get together, I'm going to fight this, and then move on. So I got through that sort of fear in the initial stages of being told that I had leukemia and the shock of it, to actually by 5 o'clock when the ambulance came was like, right, what do I need to do?
Wow.
And that's really that 2 hours of sitting back thinking of family and all that, saying, you know, going through your mind the emotions, and all that, just saying, well, you know, I'm going to fight this, I'm not going to let this knock me down. I've family, I've everyone around me, so I'm just not going to take this lying down and just get on with it. So
and that would be
I was
the day
waiting.
that they would know, your families, and that would be what they would expect of you in how you coped during that, say, 2 hours?
Yeah, a lot of it, I suppose, I feel, well, I suppose family in the way, a lot of them found out strangely in different ways. It was unusual.
That 2 hours while you were waiting for the
Did I phone anyone? Well, I didn't do the phone, I did the talk, and during the phone, and what happened to me is that in my family, I've got my sister who's a district nurse, she's a nurse, and she's married to a GP, so they were away on holidays in Egypt at the time. I have an older brother then who's an engineer, another brother who's a pilot, and another brother who's an optician. And they were going through the adoption phase over in China, so they were ready to go to China to collect their first child. And at that stage, from the telephone calls, I'm there saying, well, I couldn't tell the parents age and all that, and it wouldn't be right over the phone, etc., and telling them. I thought the nurses and the consultants were talking to me, and the consultant says, believe me, with your sister away on holidays, no matter, once with nurse and all that, she will want to know straight away. She'll want to know. So I argy-bargied with them for a while, but they showed me the light anyway. And true enough, the consultant rang Margaret and told them on holidays. They were due to come back in 2 days' time anyway.
Okay.
So they were told. So that was fine. Then I was looking at it from the point of view of, okay, who next I could get in order to inform the rest of the family. And going through it, my brother obviously going through the adoption, etc., he had enough on his mind. And then I said, well, the only one, like from the point of view of facts, cool, calm, collected, and been able to explain it to the folks and get all the information when I do go into the main hospital, would have been Andy, the pilot. If he could look after 350 people in an aircraft, I'm sure he can handle in telling this and getting the facts. So he was phoned, and he came in then at 7:30 that evening then to get the full details.
And how you were feeling, and then been given the diagnosis of, you had acute myeloid leukemia?
That's right, yeah, I had acute myeloid.
When you were given that diagnosis, did it make sense? Did you feel that unwell, or or was it still like, or is it comparable?
I suppose looking at it, well, the fact that I had symptoms at the point of view of I was really sick at that stage. I mean, having the cold sweats and all that, and obviously having the sore throat, and I had ear infection as well. At that stage, when been told about acute myeloid leukemia, I didn't know an awful lot about it. I knew obviously of leukemia and there was treatments for it, but I didn't know the full extent of it, and I didn't know in the sense of where I was at in the point of view of, well, am I meant to be experiencing this as part of the leukemia itself? And that goes back to the point originally whereby I left it so long from the point of view of going in the doors to get my bloods taken and the treatment. I should have gone in, obviously with the GP been away and still feeling sick, is go to the nearest GP again and be seen to, because I was informed that I was on getting chemotherapy on that Tuesday evening. They said had it been by the Thursday or the Friday, there would have been nothing they could do for me.
Wow.
So early diagnosis is obviously key in a lot of things, and then again I look at it in a lot of stupidity and me not going forward in the first place in the point of view. So great in getting the checkups done every year, but when it comes to that following second checkup, leaving it to your doctor, I look back now and say, well, I should have acted a lot quicker, but there's more than one doctor in the country.
And when you came to the mater, you came on the Monday or the Tuesday?
Came on the Tuesday.
Tuesday. And tell me what happened there.
Okay. So I was brought from the Beacon Clinic then around 5ish through rush hour traffic in the ambulance straight over to the mater here. I was then brought up to the St. Vincent's ward. I was then brought in and I was introduced to Michael Fay, who was the doctor on call at that stage. Again, he explained obviously the results, that they had checked them and verified them as well, this is the case, that I had AML. It was later that I found out it was MO2 that I had. But I was basically, shown my bed, got changed obviously into my pajamas and whatnot, lay on the bed, and I was probably on the bed about a half an hour and then chemo started straight away. I was told at that stage, like my white blood cells were in the tens of thousands, which they're normally in single digits.
Sure.
So that's how high it was at the time that I was caught it.
And did anyone speak to you about fertility at that time?
They did, and I suppose at the time of the sickness and getting that treatment, I suppose it went in one ear and out the other, obviously for the first night of the treatment that I was getting, getting used to the new environment, and obviously knowing subconsciously in the back of my mind that the rest of the family at 9 o'clock or 10 o'clock at night were being told of my diagnosis. But it did go in my ear and out the other at that stage, because it was the last thing, to be honest with you, on my mind at that stage. It was only on the following day then that when I started to feel a bit better, etc. And obviously getting a good night's sleep. I think I only got in the 3 days leading up to me going in, I think I got about 5 hours sleep.
Wow.
So
Pretty exhausted.
I was fairly exhausted at that stage, absolutely. So yes, it was brought up with me, and the following day, when I was more sound of mind, you may say, I was brought through what would actually be done, etc. And they were making arrangements for me to go down to the rotunda then as soon as I was feeling fit and able to go down. Yeah, they did.
And from your perspective in your life, was it something that you mentioned your partner Barbara, had you spoken about having children, or was that something that was?
Yeah, well, it was there. I was love to have had children, I suppose, looking back in certain respects, and with the partner Barbara, I suppose the stage that I met Barbara actually the summer before I was diagnosed.
Okay.
So it was a bit of a roller coaster. I'd known her in previous years as young school kids from holidays and all that in Donegal, but for children didn't really come into it at that stage.
Sure.
I knew I was getting old, blah, blah, and obviously she, from her background anyway, she had 3 children of her own anyway, so it wasn't the de facto of the relationship that was there. So it was, I suppose in hindsight, it was easier in the pressure point of view.
Okay.
You know, it wasn't the be all end all in our relationship. You know, I look at my brother who went through adoption and all that, but unfortunately can't. So, you know, it's different strokes for different folks.
Sure. And where is that with you now? I suppose that piece, because the Harry unit was just physically it was you weren't in a good place at that time. So there was no sperm donation made.
There wasn't. No.
And now, where we're in 2011, is it an issue for you and Barbara, or not?
Yeah, no, not at all. I mean, I look at every day. It's funny, it's different looking back on what you look at things in life. My whole perspective of life obviously has changed. But I look at that day, the 24th of September, as just been born again. Myself, never mind, you know, wanting to be a father and all that. And so those issues with children and all that, no. I have a great relationship with her children at the moment, so I'm very happy with that anyway.
Okay. So what was the treatment plan for you? What did they talk to you about, or what did it look like?
Sure, okay. Initially when I went in and I met the consultant then, Dr. O'Gorman, and following tests I was told then it was the MO2 that I had. My course was basically that I was going to go through 4 stages of chemotherapy, and within that process as well they would look at stem cell transplant. The treatment started off obviously on phase 1 of it. I was in for 4 weeks. During that period my family then were all tested, my brothers and sisters were actually tested then for an actual match for me. Fortunately, as luck goes, that I didn't have a match within the family. Wasn't a big issue, it'd be a bonus if I was there, yet I was lucky, you know, the way I was. So I suppose it might have been down from the family point of view, but listen, there was nothing to be worried about at all. But the treatment itself, was over, phase 1 was over a 4-week period in timescales. Mine went on, obviously been sick about that extra, went on for about 5 weeks or so. The treatments they were giving me, obviously the chemotherapy on a daily basis lasts for between 5 and 7 days of chemotherapy. There was different type drugs. There was bags that would be used for intravenous drip that would be for about 3 hours. 2 to 3 hours, and there was other ones then that would just last a half an hour that they would be injecting into you.
Okay. And how long were you in hospital then? So they had planned that you'd do 4 cycles of chemotherapy, and approximately a month long. How long from start to finish were you in hospital?
I was in hospital for a solid 6 months.
Wow.
6 months.
Did you get any time out at all? Or?
Absolutely. During the different phases, so I went through the 4 actual phases. So as time went along, phase 1, as I say, was about 5 weeks for me initially. Then I got about 7 days out, which was normally around Dublin here, whatever, on phase 1. Phase 2 then again was the same thing, about 4 weeks of treatment. I got another 5 days out at that stage. And even during the phase 2 of it, from the point of view of how well off feeling or getting out was. Like, I mean, I was able to drive up to Donegal for a few days and come back, so I mean, it wasn't, it was manageable, the treatment in that sense. But there were weekly, more or less a week, 7 to 10 days was the break you got.
Okay, and you maximised that?
Absolutely.
Well, it sounds like you were in a position to, your quality of life was as such that you were well enough to do certain things.
Sure. Absolutely, well enough to do it, and one of the things that I had as well, I suppose, looking back at it, things that I did learn from the experiences, coming from a project management point of view and starting timelines, you know that they're going to move a bit. But unfortunately, psyching myself up when it was phase 1 and been told that you'd be in for 4 weeks, you were looking for those days saying, right, you will get out. But one tip is your body will actually let you know when you're getting out, because I was counting down the days, having laughs with the patients and waiting for my white cells to come up, my platelets to come up to 100, and no, they weren't coming up to sufficient levels, so I had to stay in an extra day waiting for the consultant to come around.
So planning wasn't...
Planning is not the idea, let your body do the planning for you. Absolutely, that's one tip that I've learned, because you set expectations for yourself and other people, saying, oh yeah, well I should be out on Wednesday, I'll be able to meet you on Friday or Saturday and all that, and then suddenly the word gets, no, you won't be out till another 4 days, we'll review it again, and that sort of just puts a bit of dampener on you, so don't set expectations in the sense of
And how did you
your
cope
treatment.
During those 6 months? What was it
Wow.
like for you?
I suppose coping with it is keeping the mind busy. On phase 1 of it, obviously it was all new to me, and getting used to the actual treatments and the life cycles and the daily routine with the nurses, etc. You all have to feed in and you have to support each other. So that was getting used to it, was in the phase one stage of it. Phase 2 and phase 3, well, it was, what do you do with your time when you're in there? You get tired during the day after chemotherapy treatment. Yes, you do have friends and all calling in to see you, but you have your own my time or my space. I was lucky in the point of view the brother gave me a laptop, so that was able to keep me occupied while I was inside. Mentally as well, keeping yourself astute, and so I was doing the Institute of Bankers exams online while I was in there.
Wow.
During my treatments. That was purely a mental thing, to psychologically vote with himself to still stay on the road of acting as normal as possible, and again looking for an end date of, I'm getting out of here, I'm not going to be staying in here. So that's what kept me going. Family, obviously the routine, family and friends calling in. We always did it in the sense of having a rota base that's there, because it's very tiring as a patient on a daily basis if people are coming in, and particularly over the cycles where, say for example, there would have been 7 calling to me at different times.
Wow.
They'd be asking you how things were, so you're repeating yourself. And no offence to the family, but when you're repeating yourself all the time, it is quite tiring, repeating it. So a rota was actually put up in the point of view of who would come in when, and then they would tell everyone else how things were. And it's easier on the family as well from the point of view of travelling and distance wise.
How do you think Barbara and your family coped during that time? What was it
Wow.
like for them?
Well, I suppose speaking from Barbara's point of view, it was shock and awe from her, and it was hard from her point of view, being so far away in Donegal, hearing the news. But then again, I have a great family in the sense of, I'm very lucky with two in the medical field there, whereby they were able to talk to her and explain things to her. And she knew of people up in Donegal, close up there as well, that had cancers as well and that were treated for it. But it was the shock and all. But no, she handled it quite well. I must say, it was brave. She certainly showed a brave face coming in to see me on the weekends, coming down the bus every weekend to see me.
Yeah, because as you say, your relationship was really only starting
Sure,
off. Yeah, so
absolutely.
a big pressure on both of you, I suppose, for something like this to happen.
Make or break, as they say, but so far it's been good. It's made us, and
did it change your relationship in any way?
Oh, it did. Appreciate things an awful lot more than what we have. Absolutely. Really? And that's why it goes back to that whole thing you were asking about the rotunda, etc. I mean, from the children point of view, like that now is the least of my worries, Just lucky to have her kids, obviously, I get on well with, and obviously my own family and all that, having them around.
So has it changed your perspective in some way about life, or?
Oh yeah, I mean, appreciating things from a work perspective. I used to get stressed out in the sense of, now stress is good in certain respects.
Sure.
Everyone needs a bit of it, but from looking at things, seeing what's important. I'd always had tunnel vision and a sense of view of getting on, aspiring on my job, moving on, going up the ladder, and then suddenly, as the organisations obviously get bigger and all that sort of thing, and the work and the input that you do, you realise how much time you're actually spending in work as opposed to the quality of life you have outside. Now, work were very good to me, don't get me wrong, but I think a lot of people just focus on, the job, and then forget about the other things in the background. I've reversed it more, that it's more family and all that around first, and then it's actually the job in the sense of what's out there.
So
just purely what I'm going
priorities in
through.
some way